people do a whole lot of self-medication. Someone telling you, oh, I took Ampiclox for these and it works, so you should just walk into the store and ask for Ampiclox and take it yourself.
I feel that drug has suffered in this country a lot.
Yes. Now, if you feel that you've been tested positive to any of the sexual transmitted disease, I'm talking to a client over the counter and the person is like, I'm going to be giving you 50 milligram, take 2 times. They don't like, no, I'll take 100. The medication your friend is taking is not meant for you. Do you know antibiotics resistance can lead to infertility? Maybe you just be scrolling through the social media and you be seeing medications like this one can cure this, can cure that, can do a whole lot of things. And sometimes people just screen grab it for me and tell me, Benza, what do you think about this? Because there are a whole lot of fake medications out there. Before you comment any antibiotics, please.
I'm coming here today with a story. So someone came to me. I was like, Nurse AK, something happened. I'm like, okay, what happened? I was like, I got sick. I got treated. But it's been about 6 years. And then, I've moved on. I got married. We talk about sexually transmitted infections a lot here. So I once had a STI during my younger days, but then I moved on. But when I was about to get married, I popped up in the clinic again, did a test, and I was still positive for that same infection. What could have happened? And then I've realized that this is not just a one-time thing. It's something that keeps reoccurring. Different people bringing in different stories, either from complication or maybe from their test result. And then we notice that, especially when it comes to bacterial infections, that people are not getting cured. It's popping up later. And it seems that maybe the antibiotics that they're using, is it that it's not working? Or is it that maybe they're not using it the right way? So today we want to talk about antibiotic stewardship with emphasis as it pertains to sexually transmitted infection. And I'm here in the studio with an amazing person, Fam Benza. A very nice name, Benza. This is Fam Mabong Benson. Thank you for joining us.
Thank you so much, Nurse Apan. It's good to be here today. So
Benza. That's a nice name. I'm thinking it's connected to the Benson.
Yeah, it's connected to the Benson from my surname, Benson, then Benza, then. So that's just it.
All right. So let's get right into it. So I have people coming up to say that they're finding it harder to treat STIs like gonorrhea, for example, that, it's bacterial inclined. What is the issue? Why are we having this problem? Is it that the antibiotics, what differs? It was easy to treat gonorrhea yesterday. Let me put it yesterday than now. So what's going on in the antibiotic space?
Okay, like you earlier mentioned about the antibiotic stewardship. So first of all, let's define that. It's just simply management of using antibiotics to manage sexual transmitted disease in a responsible way to actually ensure effective use and to avoid complications like the story you just introduced earlier. So it's simple. Now, these things are happening because we're not following the guidelines, actually. Normally, there's supposed to be guidelines for these where we follow, like, in the case of someone is coming to complain, like in the community practice, first of all, you could advise these individuals to carry out a test because you do not just want to dispense antibiotics. You just ask to carry out a test to ensure that is it a bacterial infection, is it a fungi infection, or whatever it is. Okay. So in that case, if that is being done, then we can now proceed to know which antibiotics to prescribe. So I think basically what is happening in these days is that people do a whole lot of self-medication, and in such a way that maybe you could just hear an information, someone telling you, oh, I took Ampiclox for these and it works, so you should just walk into the store and ask for Ampiclox and take it yourself. That is where the problem is. And sometimes the medical people, we don't also carry out a proper investigations, like proper evaluations, doing some sort of assays and like to know which antibiotics is being prescribed. And sometimes we even skip the first line of the medications and proceed to the other brands and stuff like that. Because if the procedure is being carried out, I think the whole scenario that is been happening of people developing resistance is not going to happen.
All right. So just before we come to that, because you mentioned a couple of things, I did look into it and I see that there are some trends that have been defining what people are experiencing now. But then you mentioned ampiclox. I feel that that drug has suffered in this country a lot.
Yes, why? I think so,
No, because
because
I know people take it as a form of contraception.
which is not so.
Yeah. So I remember being around, like you said, especially in the communities. If you hang around like way drugs are dispensed in the communities, people come in a lot. It's always good early in the morning.
No, no, no. It's
So they'll come early in
actually
the morning after the night activity. They'll come early in the morning
okay.
and be like, "Can I have ampiclox?"
And sometimes you will like someone who just come in and like I need ampiclox and you're like, please, okay, for we give like for duration of 1 week. And I'm like, no, I just need just a sachet. Like I won't take everything. I'm like, that means you're abusing the medication, you're taking it for the wrong cause. You're not doing what you're meant to do. And when you try to advise the patient, it seems like, oh, I've been doing this, it's not you that's going to tell me. So I think we the health professionals, we really have a whole lot of work to do to counsel and educate patients and probably make the information go as well as possible to help people to understand that it's not just you should always go to the right thing, like do the right thing, get the right prescription, go to the right lab and get tested before you just start taking any antibiotics rather. So
All right. So you've mentioned a couple of trends because I know that self-medication has been a thing, especially around here. Maybe it's because of the shame associated with sexually transmitted infection. People find it harder to, somebody can walk into a place and like, I have malaria, do me a test,
okay.
right? But then if this is like a lab was thing and
Okay.
if somebody comes in and say I have malaria, everybody will still be like doing what
Okay.
they're doing.
Okay.
But if somebody walks in and like I have gonorrhea, or I think I have gonorrhea, everybody pauses and
Okay, I think because of the WHO standard, like in the case of where we don't have symptoms, gonorrhea and syphilis are those tests that should be carried out on a normal, like for in the case of sexually transmitted disease. So if someone said I have gonorrhea, maybe the person has seen the symptoms of painful urination, discharge, though those are the symptoms in men. But in the case of women, may just have abdominal pain. Sometimes it even can be asymptomatic in women. Do you understand? So if someone said, okay, then we carry out the test and go for the basically the cephalosporins can actually do that. So I feel if someone walks into the I feel if someone even walks into the lab and like I feel I have gonorrhea, okay, first of all, as a health professional, I know it's a very confidential information. So you just have to like, okay, first of all, let's carry out the test and to just
no,
confirm.
because I understand that's what you're saying, but these are the things that when I interact with people, they talk about the attitude of the healthcare professionals.
Okay.
In terms of how people react.
Okay.
So, like I said, malaria, everybody will just be like,
Okay.
mosquito, they bite everybody, and
Okay.
everybody will go their way. When you like gonorrhea, sometimes, like you said, if the person doesn't act professionally, you see the, should I say, the ambience of the whole room
Yeah,
changes.
yeah.
Everybody starts to
Yeah.
still glances at you and sometimes pushes people. Then you talked about the issue of wrong dose. Could this also affect where people have to overdose? So some people feel that, so I know people that they give them a particular drugs, maybe for example 400 milligram, maybe like take it 3 times a day and they'll be like 400 milligrams won't do. I feel like I need to kill this thing fully, so maybe let me double the dose, let me take 800 milligram.
Okay.
So will this also play into this problem that we're having?
Yes, actually, because normally you're supposed to take the right medication at the right time at the right dose. So if you're doing anything outside this, that's actually drug abuse, and that's actually going to lead to this resistance we're trying to fight. Do you understand? So don't people should not feel that, oh, because I've been in so much pains, I've been in so much discomfort, so when I'm being prescribed medication, I should just pop. I'm like, I'm given 400 milligram, I should go take 800 milligram, that I'm going to feel so well. No, take it, finish your dose. Or some people, sometimes when they finish, the symptoms is now less, they're now like, oh, I think I'm good. That's also the problem. Like when you don't complete your medications, and sometimes this antibiotic, I mean the bacteria is like, oh, we are here, we just died halfway and you just left us here, okay, we're going to come back stronger. That's also the problem. So people out there should always learn to take their medication as prescribed. Not because you're in so much pain, you're in so much discomfort, you're going to pop all the pills. No. please, I think that's always the problem, because sometimes I'm talking to a client over the counter and the person is like, I'm going to be giving you 50 milligram, take 2 times. They don't like, no, I'll take 100. And you don't have to like start explaining and all. Then in the case of when people come to like tell you, oh, I think I'm having painful urination and all of that, and the ambience of the room change. In fact, I think most people in the entertainment industry, they even use it as comedy skits and something like that. So it's just normal. Like people just don't feel like talking about it. In fact, I even know some people that once they just feel that way, they will not like, okay, I just want to do self-medication. I don't want to like go to the pharmacy. How will I start going to go and talk to this health practitioner? Like, what would they see and all those stuff? So it's not a problem. And also I think the health personnel are being trained enough to understand that patient informations are very, very confidential. And personally, I just try to like ensure that I give you the honest welcome, like as possible. Like I'm going to tell you, okay, this is what you need to do. You don't have to feel bad about it.
Okay.
This is that. Just do this test, take these medications, and probably sometimes we also have to follow up with these cases, because sometimes if you don't follow up, the patient feeling better for like few days will now stop taking the medications, and so your job as for personally pharmaceutical care, we just ensure that we follow up. You finish your medication. So how is the outcome? Do you have any adverse reaction? Are you still feeling better and all of that? So in case of there's adverse reaction or there's no any clinical outcome, so you can now like, okay, oh, maybe we need to change the line of medication, or did you take your medications properly? If there's a case of adverse reaction, you can now journal, like let people know, like, okay, this person is reacting to these antibiotics on something like that. Me now say, okay, I took this medication for I couldn't breathe or something like that, I was having some reaction. You know, like, okay, maybe you're allergic to this. Maybe in the case of maybe someone is tested positive to syphilis and the penicillins are being used for that, and the person is now like having allergies to penicillins. Do you understand? So that's the case of now like knowing, okay, this person can't take this, and
Can't
so
take penicillin,
yeah,
so
so
maybe
you
we should
know
try
you
something
should try
else.
something else. So that's just it.
Okay, so what of the case of the people that thinks that the more is merrier, not in terms of dosage here, but in terms of the drugs. So why do I take one line of antibiotics when I can combine 3 or 4?
It's being stated that you should go first for the single dose antibiotics.
Okay.
There's no need giving azithromycin, giving this, giving that. Let's go with the first one first. That's my principle. I go with the first line. Like, let's do the first line. And because if you're going to try other ones, before you know, you're developing resistance to the ones we're actually going to feel we're going to depend on it in the future. That is the problem. So I feel we should always streamline it to the first line of the treatment before any other thing.
All right. Because basically, I know people that feel that if you take like one antibiotics, what are you doing? You should like take more. You should combine. They call it combining. I don't know if it's the combine they sell like on the streets that is giving them. So they'll be like, you should combine different antibiotics. So if you're just joining us, this is the Intimate Matters podcast. And today we're talking about antibiotic stewardship as it pertains to STI treatment. There is so much complaint. Drugs are not working again. People are not getting treated again. And it's unfortunate that people are developing resistant forms of most of these sexually transmitted infection. And we're trying to pinpoint what could be the possible causes and solutions that, we could have for people out there, so that if you ever get infected, you go do the right thing. Because if you do the wrong thing, most likely you won't get the right treatment as it should. And then some people would say that one of the problems that they have is the issue of peer influence, where people feel that me and my guy did with this girl, or me and my babe did with this guy. This guy gave us sweetie. I think that's syphilis. That's how they call it, sweetie. So my guy don't go take this stuff. My guy is now fine. That's what they think, because most times they feel that the absence of symptoms means, and most people usually go that way. So I stay around, you see people call and be like, I forgot a big novel, what do you take for that, sweetie? And the person will just like, type a couple of drugs or whatever. How does this play into this? Because a whole lot of people are more or less, I feel people are taking more advice from their peers
Okay.
than from the right quarters.
Okay. The young population, actually, I think that's what you're trying to talk about, right? Okay. So in that case, the medication your friend is taking is not meant for you. It's meant for your friend. So if in any way you having similar symptoms or similar diagnoses or things like that, you are not just supposed to stand up and go take medication from your friend's drawer. You're supposed to go do the right thing, get tested, see a doctor, get a prescription, do some tests, and get your medication.
Okay.
I feel that still boils down to the fact that they are just shy to go do the proper thing. Yes, people are actually shy when it really comes to sexual health, talking about their sexual health in public or discussing their sexual health to family members and all of that. Now, if you feel that you've been tested positive to any of the sexual transmitted disease, it's not something you just keep to yourself. You need to also inform your partner, because if you don't, maybe you still go get
Back.
reinfect yourself and you still go take antibiotics again, and the same time it's happening, maybe you're just shy to tell your partner, oh, this is the way I'm feeling, and you're not like you go take injection and you're still going back to the same spot that is causing you the troubles, and you're still coming back to pop the same antibiotics. That's where the problem is. So with time, people develop resistance. So it's very important that partners should treat themselves at the same time.
Okay. And also for peers and friends out there, if for any reason you people decided to eat from the same pot, whatever the pot is, it doesn't mean that the both of you will have the same form of treatment, because there's a need to do, how do they call it? Is it MCS? There's something they do where they have to decide the kind of antibiotics they need to use for each individual. There's a test that is done that way to know that maybe this infection that you have, these are kind of antibiotics.
Yeah, 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 yeah.
All right. So you
yeah.
need to go to the hospital. It's quite very essential. So these are some of the things that are happening, why people do this. Now let's go into this. What would be the proper way to do it? How should I approach my treatment, my antibiotics treatment in terms of having STIs? What's the right way to do it? Let's say someone, not me, someone out there discovers that they have an STI. What should they do? What's the right thing to do?
Okay. So the guidelines will say syndromic management. That means if you just notice it's just one of the guidelines to treat or to handle sexual transmitted disease.
Okay.
But that's the case that when someone notices vaginal discharge, abdominal pains, we could just treat based on the location of those pathogens. Do you
Okay.
understand? Maybe in the case that there is no, in a setting that there is no any place to do a test or something, you could just go tilt towards that way. We would just like, okay, if the person is having abdominal pains, vaginal discharge, and all those things, so
Okay,
we
let's just treat the symptoms.
yeah, so let's just treat it toward that way. Then also they want that we have the diagnosis test, so you carry out a proper test for it and stuff like that. They also have the advanced settings. That's when we do the molecular assay to know the specific antibiotics to be used in that case.
Okay.
Yeah. So those are the few methods that we can use to.
Okay. So what do we say to the people that feel that because you talked about treating of symptoms, how does that also play with the fact that there are people that only take antibiotics till the symptoms disappear? They don't take the full course. I was itching, so I started antibiotics. Maybe like you said, it was for 7 days, 2 days in, 3 days in, my itching is gone, and I let it go. So how do we marry that?
Okay. People should always complete their dose. That's what I can say. Please, like, I think, let me put this out there. Just try to, if your medication is being prescribed for 5 days, take it for 5 days. The itchiness may just feel it's not there anymore, but please complete your medications, because if you don't, before you know, you've developed resistance to that particular antibiotics. And people are like, I've been, and then maybe in future it's like, I've been taking this. This doesn't work for me. This doesn't work for me. And you're like, people are like, why are you giving me that? I've been taking it. It's not working for me. What did you do that is not working for you? Maybe something happened. Maybe there was an abuse in the past.
Okay, so you've mentioned so I know there's antibiotics resistant, but just say to all the people out there, because when people there's been not just antibiotics, antimicrobial
Yeah.
resistance all over, and sometimes when you speak to people, it's like big grammar, antimicrobial resistant. What does it mean? So, can you just like put it on a very simple term how this happened? How does resistance happen, and what is resistance?
Okay. This is just what it is. Like I said, it's just antibiotic stewardship. First of all, it's just the responsible use of antibiotics
Okay.
for us to achieve the effective treatment. Now, in the terms of resistance, it means that this antibiotics that was being prescribed for you is no longer taking care of the issues that is meant to.
Okay.
For example, it's you're taking a medication that was prescribed, and you're still coming back with the same issues every time.
Okay.
That means probably there is a resistance somewhere. The antibiotics is not acting, or maybe the
Cannot kill the
yes, cannot kill the microbes. That's what it just. So that, I think that's just what it means.
Oh. So, as you're out there, just make sure that you do the right thing so that anytime you take the antibiotics for whatsoever reason,